Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, surgical removal of intrathoracic goiter. So, if there is a goiter inside the thyroid, inside the thoracic cavity, then how are we going to remove it? So, in the surgical removal of thoracic goiter, especially when do we call that the goiter is mediastinal? A goiter is said to be mediastinal, or mediastinal goiter is actually seen in at least is said to be a goiter is said to be mediastinal goiter if at least 50% of the thyroid tissue is located inside the thorax. If 50% of thyroid tissue is located inside the thorax, then we call it as mediastinal goiters. These mediastinal goiters are actually two types. We have primary mediastinal goiters and secondary mediastinal goiters. Right. Now, if there is a mediastinal goiter, first how are you going to remove them? So, we have to remove all the mediastinal goiters, or most of the mediastinal goiters are mainly removed via a cervical incision. We give a cervical incision and then we remove the mediastinal goiter in most of the cases. But in some cases, we should do a median sternotomy. So, what are the indications of median sternotomy in a patient with mediastinal goiter? In a patient with mediastinal goiter, medial sternotomy is done if the patient has invasive thyroid cancer. In order to remove this invasive thyroid cancer, we should do medial sternotomy, because we should remove the thyroid cancer with clear margin so that the thyroid cancer should be removed completely. So we do median sternotomy. Similarly, if the patient had previous thyroid operations is done. If the patient already had previous thyroid operations, and because of these previous thyroid operations, if the patient has developed some parasitic mediastinal vessels, in such cases we can't do any blind dissection. We should do a median sternotomy and then we should remove the goiter. Then, if the patient has primary media present and there is no thyroid tissue in the neck, obviously, if there is no thyroid tissue in the neck, there is no need of doing a cervical incision. Right? We have to do a mediastinal sternotomy and we should remove the tumor if the patient has no thyroid tissue in the neck. Now, first goiter. In the goiter, we will give a cervical incision or neck incision is done, and then if the medial sternotomy is indicated, then this medial sternotomy, it is mainly done by, first you will have to divide the sternum. That is, dividing the sternum should be done. Especially, it is dividing the sternum. We should divide the sternum at around third intercostal space, and then the incision should be extended laterally between the third and fourth ribs. Obviously, this is where you see the third intercostal space.
thank you and thank you for watching.